This training session is going to be focused on Medicare, known as Original Medicare, which is Part A and B. To start with, what we need to do is you need to know that Original Medicare was formed back in the 1960s by the federal government's health insurance program for the disabled and the elderly, known as CMS. Now, CMS technically stands for the Centers for Medicare and Medicaid Services. And so that's what it's designed to do. It's the federal health insurance program. Now, there's two main parts to Medicare. Original Medicare is known as Part A and Part B. Part A is known also as hospital insurance. Now, here's how you qualify for Part A. Number one, you have to be 65 years old. And if you want Part A with no premium, either you or your spouse has to have worked and contributed into the Social Security system via a Medicare tax for 40 quarters. The other way to get Part A before you turn age 65 is to be on Social Security disability. Social Security disability has to be in effect for 24 months, and then in month 25, Part A kicks in. Now, it seems a little bit odd that someone would have to be disabled, and for the first 2 years of their disability, they have to figure out health insurance on their own. Medicare is not going to cover them. But that's the way it works. Month 25, your Part A can begin. Now, there is a deductible that goes with Part A. You can go to Medicare.gov to look at what the current deductible amount is. The way the deductible works for Part A is it's per benefit period. Now, the way Medicare defines a benefit period is any stay in the hospital separated by 60 days then starts a new deductible period. So if you're very unfortunate, you go into the hospital, you're out for 60 days, and then you go back in again, you pay a deductible all over again. And that could occur several times throughout the year. If you have no other coverage for hospital besides Part A, you would pay that deductible multiple times. There's also, for most people, no premium for Part A. As long as you or your spouse have contributed for 40 quarters, there is no premium. However, if that's not the case, and we see that happening more and more now, then there will be a premium for Part A. What we see happening is there's a lot of folks that have moved here from another country, they've worked, and then their parents want to come and join the kids. So the parents show up and they want to get insurance, but they haven't contributed into the Medicare system, so they would have to pay that premium. So that is just one factor to consider. The second part of Medicare that we're going to talk about is Part B. Now, that's also known by some people as doctor insurance or medical insurance. Now, in order to qualify for Part B, you need to be 65 years old or have been on Social Security disability for 24 months. There is a deductible for Part B, which you can also find the current amount on Medicare.gov's website, and that deductible is per year. It is not the same as Part A. The other thing you need to know is there is a premium for Part B. Now, if you're on Social Security, that premium is going to be automatically taken out of your Social Security check. There's no other option, and that's the way it has to be paid. However, if you've chosen not to yet take your Social Security, you can pay that quarterly, or you can set it up to come out of your checking account, or even now be charged to your credit card. There's another part of a premium you need to understand too, and that's IRMAA. A few years back, our government decided that if you make a lot of money after you're already eligible for Medicare, then they're going to charge you an income-related monthly adjustment amount, known as IRMAA. Basically, it's a surcharge. Then there's a chart that shows the more money you make, the higher this surcharge gets. And then that's just something you have to pay as a higher premium for your Part B. So that's IRMAA. The other thing I want to talk about briefly is the penalty. There is a penalty if you don't sign up for Part B when you become eligible and if you don't have other creditable coverage. So basically the government is going to say that there's going to be a penalty for not having health care coverage when you're over 65. Now, if you're working and you're still on a company's group plan, you're totally fine. But let's suppose you turn 65 and you say, I'm fairly healthy, I don't go to the doctor, I don't want to pay whatever this premium is, I may not want to pay this IRMA charge, I'm just going to wait a couple of years and then I'll get on Part B. Well, here's the thing you have to understand. Part B premiums are the same whether you're 65, 85, or even 105. And in the insurance world, you can't charge the same premium for health insurance to people of different ages. But the government does. So, in order to make up for those people who are just going to skate in and get the coverage right before they get sick, they charge a penalty. So if you go 2 years without any credible coverage after you're eligible for Medicare and you're older than 65, then there's going to be a 10% penalty on whatever the Part B premium is at that time, and you're going to pay that penalty for the rest of your life. Now, there's even more information you need to know. If you miss getting Part B when you were supposed to, and you do have to face this penalty, you can't just pick up Part B anytime you want to. The only time you're allowed to enroll is during the general election period, which runs from January 1st to March 31st. So you can enroll then, but it does not become effective right away. It does not become effective until July 1. So you have to make sure you know how these rules work. And you also have to remember that not everything is considered creditable coverage. Some people think that COBRA is considered creditable coverage. It is considered creditable coverage for Part D for the drug plans, but it is not considered creditable coverage for Part B. Thank you.